Hazards of diabetes. It might not be causing you discomfort now, but it can wreck the future you. Diabetes complications. Diabetes, a condition that affects millions of people worldwide, is often dismissed as a minor inconvenience. But the truth is, diabetes can have serious and potentially life-threatening complications if left untreated or unmanaged. From kidney failure to nerve damage, this chronic disease can wreak havoc on your body in ways you may not even realize. In this blog post, we'll explore the hazards of diabetes and why it's so important to take steps to prevent and manage this condition before it's too late. So sit back, grab a cup of coffee, or water, and let's dive into the world of diabetes complications. What is diabetes? Diabetes is a chronic condition that affects how your body processes glucose, or blood sugar. Glucose is a primary source of energy for your cells, but it needs insulin, a hormone produced by the pancreas, to enter your cells and be used as fuel. With diabetes, either the pancreas doesn't produce enough insulin or the body can't effectively use the insulin it produces. There are three main types of diabetes. Type 1 diabetes, an autoimmune disease where the immune system attacks and destroys pancreatic beta cells. Type 2 diabetes, the most common form, which occurs when the body becomes resistant to insulin, and gestational diabetes, which develops during pregnancy. Left untreated or unmanaged, high levels of glucose in your blood can lead to various complications such as nerve damage, kidney failure, eye problems, cardiovascular disease and more. That's why early detection and proper management are crucial in preventing these hazardous outcomes. How to prevent diabetes? The best way to prevent diabetes is to maintain a healthy lifestyle. This includes a balanced and nutritious diet, regular exercise, and stress management techniques. A diet that is rich in fruits, vegetables, whole grains, lean protein sources, and low-fat dairy products can help to control blood sugar levels. Avoiding sugary drinks and processed foods that are high in calories but low in nutrients is recommended. Regular physical activity can also help with weight loss and improve insulin sensitivity. Engaging in at least 30 minutes of moderate intensity exercise each day can have significant health benefits. It's important to get regular checkups with your doctor to monitor blood sugar levels and identify any potential risk factors for developing diabetes. Making these lifestyle changes early on can significantly reduce the risk of developing type 2 diabetes later in life. The different types of diabetes. Diabetes is a chronic medical condition that affects how the body processes blood sugar, or glucose. There are three main types of diabetes: type 1, type 2 and gestational diabetes. Type 1 diabetes is an autoimmune disease that develops when the pancreas can't produce insulin, which regulates blood sugar levels in the body. This usually occurs in children and young adults. Type 2 diabetes is more common and typically occurs later in life when insulin production decreases or becomes less effective. It can be triggered by poor lifestyle habits such as unhealthy eating and lack of exercise. Gestational diabetes only affects pregnant women who have never had diabetes before but develop high blood sugar during pregnancy. Although it usually goes away after delivery, it increases risk for both mother and child to develop type 2 diabetes later on. It's important to understand which type of diabetes you may have because each requires different treatment plans and monitoring measures. Regardless of which type you may have, managing your blood sugar levels through healthy dieting habits, regular exercise, medication adherence, if necessary, will keep associated complications at bay. The symptoms of diabetes. Diabetes is a chronic disease that has become increasingly common in recent years. It's characterized by high levels of sugar, glucose, in the blood, which can lead to a variety of complications if left untreated. The symptoms of diabetes vary depending on the type and severity of the condition. However, some common signs include frequent urination, excessive thirst, blurred vision and fatigue. Some people may also experience unexplained weight loss or gain, slow healing wounds or numbness in their extremities. In type 1 diabetes, these symptoms may develop quickly over a period of weeks or months. On the other hand, type 2 diabetes may be more gradual and go unnoticed for years until complications arise. It's important to note that not everyone with diabetes will experience all these symptoms at once. In fact, some people with type 2 diabetes have no noticeable symptoms at all. If you're experiencing any of these symptoms or are concerned about your risk for developing diabetes, it's important to speak with your healthcare provider as soon as possible to discuss testing and treatment options. What are the complications of diabetes? Diabetes complications occur when high levels of glucose in the blood damage various organs and systems in the body. People with diabetes are at risk for long-term health problems that can affect multiple parts of their bodies. One major complication of diabetes is kidney disease, also known as diabetic nephropathy. High levels of glucose in the blood can cause damage to the small blood vessels that filter waste from the kidneys, leading to chronic kidney disease and even kidney failure. Another common complication is liver disease, which occurs when there is an excess amount of fat stored in the liver due to insulin resistance. This can lead to non-alcoholic fatty liver disease, NAFLD, or non-alcoholic steatohepatitis, NASH, both of which can progress to more serious conditions such as cirrhosis and liver cancer. Diabetes also increases your risk for neuropathy, nerve damage that affects different parts of your body including hands, feet, eyesight and hearing. Neuropathy may cause tingling sensations, numbness or pain in affected areas. People with diabetes are at increased risk for heart attacks and strokes due to uncontrolled high blood sugar levels over time damaging blood vessels throughout their bodies which could threaten circulation. It's crucial for individuals with diabetes to take measures towards prevention by managing their condition effectively through healthy lifestyle choices like regular exercise programs and balanced diets while consulting professional medical advice whenever necessary. How can I prevent diabetes complications? Managing diabetes can be challenging, but preventing its complications is even more crucial. Fortunately, there are steps you can take to prevent or delay the onset of diabetes-related complications. One essential step is controlling your blood sugar levels. Consistently high blood sugar levels can damage your nerves and organs over time, leading to kidney disease, nerve damage, neuropathy, and eye problems. Eating a healthy diet that's low in carbohydrates and saturated fats while rich in fiber and lean protein sources like fish and chicken can help manage blood glucose levels. Incorporating physical activity into your routine also helps with weight management as well as lowering insulin resistance. Additionally, quitting smoking if you're a smoker reduces the risk of developing cardiovascular diseases, which diabetics are at higher risk for. It's essential to have regular checkups with your doctor too. They will monitor any potential complications early on before they worsen. Diabetic patients must always adhere to their medication regimen as prescribed by their doctors regularly. Taking these measures is necessary for preventing or delaying the progression of diabetic complications that could cause serious harm to different body parts such as kidneys, liver, pancreas, and neuropathy later in life. Conclusion: diabetes is a serious disease that can lead to various complications affecting different organs in the body such as the kidneys, liver, pancreas, and nervous system. While it may not cause discomfort initially, its long-term effects can be devastating. Therefore, it's important to adopt healthy lifestyle choices like exercising regularly, eating a balanced diet and maintaining a healthy weight to prevent or manage diabetes. Additionally, regular checkups with your doctor and keeping track of your blood sugar levels are crucial in managing the disease effectively. Remember that prevention is always better than cure. By taking control of your health today and making positive changes in your life habits, you will minimize the risk of developing complications associated with diabetes down the line. With proper care and attention, you can live a full life despite having diabetes.